everybody. Thanks for coming tonight. I'm Rob Downey. I'm a family practice MD here at SVT Health and Wellness, and I'm also the medical director. And tonight we'll be talking about a topic that's near and dear to my heart, functional medicine. And there will be a question and answer period, but I'll go ahead and share with you a presentation I put together for Alaska Primary Care Association, and also which I showed up at the Native Medical Directors meeting up at Alaska Native Tribal Health Consortium. A little of it I'll move through a little more quickly, the parts that might not be as interesting to you, but I think most of it you'll find kind of applicable and interesting. And it's been a project of mine actually I've been doing functional medicine for 8 years now, and I had always wanted to kind of summarize it for myself and others, how it works and what the principles are. And so I actually ended up really enjoying putting the presentation together, because I think, anytime you come up with a presentation, you sort of summarize and distill your thoughts and decide which insights are most important. So, first and foremost, my hat, as it were, is to be a board-certified family practitioner. And that's always first and foremost how I see and do things. And certainly there are healers out there who their certification or what have you is in natural medicine only. One of my heroes, Hillary Daly, who's a naturopathic doctor, that's where she comes at things from. She and I have seen patients together for 8 years together at the point of care, actually down in Montana, and for a year up here in Alaska. But it just so happens that the main way that I was taught to see things was through an MD lens, and that's, for the remainder of my career, that's kind of going to be my primary certification. Anyhow, I went to this Applying Functional Medicine and Clinical Practice 5-day course from the Institute for Functional Medicine in 2006. Since then, I've done training modules from the Institute for Functional Medicine, and also I'm now a certification candidate. They've come up with a certification program in the last 5 years or so, so I'll be certified over the next few years from the Institute. But there was a pretty gritty, might be the right word for it, background for me in family practice. Some family practice doctors don't necessarily see or treat a ton of hard stuff. Family practice docs in Alaska see and treat a lot of hard stuff because there's no one else. And so my last year of residency, I knew I was heading up to Kotzebue, Alaska in 1999, and I did a lot of obstetrics and emergency room work and stabilizing trauma patients, etc. So from 2000 to 2002, I was up in Kotzebue, and I did inpatient medicine, outpatient medicine. I was the obstetrician, I was the ER doctor. I flew out trauma on Learjets, fixed-wing aircraft crashes, drownings, the whole deal. And I do think that kind of matters. At least it's mattered to me, just because one of my biases has been that it really helps to do natural medicine well if you do conventional medicine well. I think it means that you catch important stuff, you catch rare things, you remember that herbs and lifestyle changes are really powerful, important things, but there's a time and a place for an urgent intervention or a tumor to be cut out or what have you. So that just happens to be my bias. Anyhow, I don't have any disclosures. I'm not going to sell you anything, and mentioned already that half my work here is clinical, and then I do administrative work here as well. Most of my clinic visits here at SVT Health and Wellness are integrative medicine visits. If the health side of this facility is short of folks or etc., I still sew up lacerations and treat pneumonia with antibiotics, but my passion's for integrative work, and there's a lot of appetite for it here in town, and there aren't other people on staff with my exact skill set. So strategically, we've just decided it's really best for me to focus on functional medicine. So in terms of what is functional medicine, this is the cover of the functional medicine textbook, which came out about 10 years ago. But just to give you a sense of where this all started, there's this comment in British Medical Journal 2003. It's almost a daily occurrence for primary care doctors to encounter patients whose symptoms are probably not due to discernible organic causes. And so the functional medicine folks said to themselves, well, what processes or mechanisms are happening for these symptoms to take place? Could the organic cause that's missing be due to something that's happening beneath the surface, some sort of altered function, and thus the name functional medicine? Now really the origins go back a lot farther than 2003, because this conversation started 30 years ago in Oregon and Washington respectively. There was a family practice doctor in Oregon named David Jones, and he would see these patients, board certified family practice MD just like me, and they'd be tired and he'd work them up, and they didn't have depression, and they weren't anemic, and they didn't have cancer, etc. I mean, they didn't have, again, one of these discernible organic causes. But he knew from his med school training that B vitamins help the power plants of the cells work better. And so he thought to himself, well, gee, maybe B vitamins would help my patients. But he didn't have any confidence to, as an MD, to clinically clip these ideas into safe recommendations for patients or some sort of strategy or way of doing things. And so he started seeking out experts in Seattle who could help him begin to understand this. And he bumped into a guy named Jeffrey Bland, who was a physiologist. And Jeff Bland had worked with Linus Pauling. And Jeff Bland and David Jones started a friendship, amongst other things. And that initial conversation between those two over the subsequent 30 years grew this approach called functional medicine, a national and international conversation that includes a nonprofit institute, a textbook, a certification course, and an approach that we'll be discussing. Some of you may be familiar with Bastyr University in Washington State. I learned just recently it's actually federally funded, which is quite interesting given that it's a naturopathic college. But Jeff Bland and a naturopathic doctor named Joseph Pizzorno are the founders of that. And so similarities between functional medicine and naturopathic medicine are no surprise, because there's a joint root in Jeff Bland, the physiologist. So moving along, this on the right is an image from the Functional Medicine White Paper, 21st Century Medicine, a new model for medical education and practice. And just as kind of a point of interest, if anybody just pulls up 21st Century Medicine, you can download this document. It's about 50 pages, and it was a lot of work on the part of David Jones, who I mentioned, Lori Hoffman, the executive director of the Institute, and Sheila Quinn, to basically say, from here going forward, where can medicine go? Where can we go institutionally? How can we put drugs in perspective? How can we change medical education? So it's really quite a tour de force and a very, very interesting lens on what's happened up until now and where we can go from here. But here's the key issue. Functional medicine then is a new model of medicine, and it defines a state of chronic dysfunction associated with these altered physiologic processes happening beneath the surface of things. There's a physiologic alarm state that's created, and these are the first signs of what will later become disease. I think it really helps at this juncture to give some examples, because again, this isn't necessarily fancy textbook stuff. It's something that all of us know. So again, here's this kid who's been having abdominal pain on school days. There's a workup, there's x-rays of the abdomen, there's blood tests to make sure the liver and kidneys are okay, there's an exam, there's history taking. I mean, all of that workup is fine. This kid doesn't have disease. So what's the cure for this kid? The abdominal pain goes away. It's a stress phenomenon of some sort, and this kid hurts. And again, there are functional issues on an underlying level. Maybe those fight or flight hormones circulate in a way where there's not as good a blood supply to the stomach, and so there's a stomach ache. Anyway, the kid doesn't have a disease, but there's this abnormality of function which helps us help the kid if we understand it. Next example, And these examples are so simple, they're kind of cartoons, but again, it will turn out to matter as we march through how important this becomes, because functional medicine is really, really good at working with what are called autoimmune conditions, where the immune system attacks the self. And so this example now of how this guy's immune system works or doesn't work will kind of set the stage for the later part of the conversation. So this guy's healthy, he hasn't had a cold for a long, long time. Anyway, the next thing that happens is kind of what I referred to as the country record here. His dog dies, he loses his girlfriend, his truck breaks down, and then the next thing you know, he's got a cold. Well, those circulating chemicals due to stress dampen immune system function, and the body allocates its resources to different areas. And then the immune system doesn't block the virus from taking hold, and next thing you know, he's got a cold. So that's a functional issue, because it's not that his bone marrow's bad or he's got an immune deficiency of some sort, but functionally he becomes immune deficient when he's stressed. So that's kind of the transition into how this approach can work, and I felt that the next thing that was helpful was actually for you to hear some cases and just get an example of how this can work in practice. So these are all cases from my practice. This is a 45-year-old woman I saw in Montana. She had inflammation in her guts called ulcerative colitis, and this medication called sulfasalazine, which is an immune suppressant, didn't calm these things down. And many folks who come for functional medicine are feeling disenfranchised with conventional medicine because drugs aren't working or they want a more natural or holistic approach. Anyhow, she ended up on an anti-inflammatory diet, omega-3 fish oil at high anti-inflammatory doses. The anti-inflammatory component of turmeric, which is curcumin. Dr. Downey and I did a gut metabolism test that measured good organisms, not so good organisms, etc., digestive function, and we corrected any imbalances that were found there. Why? Because 75% of the immune system is stationed adjacent to the gut. So if you make the gut really vital, immune and autoimmune dysregulation tends to calm down. Anyhow, she had over 90% resolution of her signs and symptoms, and she didn't require her drug anymore, so she was delighted. This guy's a good case. I always love to pick on guys because I'm one, and I'm also a classic guy. I tend to have a lot of the little faults and foibles of men. So this guy came in, severe abdominal pain, big medical workup, lots of specialists. His wife dragged him in, and this guy did not like natural medicine, and he did not like me. So if I had a nickel for every patient male who said to me in response to "Why are you here?" "Wife sent me," I'd be wealthy. Anyhow, I put him on an elimination provocation diet, which gets rid of foods that can trigger food allergy or food sensitivity, soy, dairy, eggs, wheat, etc. And then the guy just disappeared. So 3 months later, I bump into his wife at the clinic. Well, he found these foods that didn't get along with him, and then he went through and challenged to figure out which foods he could put back in, and then he just quit the foods that bothered him, and his abdominal pain went away, and he disappeared. Here's a 35-year-old woman I saw. Again, these are all my cases. She had migraines. She'd had lots of Western approaches, but she'd also had lots of natural approaches. She'd done acupuncture. She'd done herbs. She tended to get one viral illness after another. She ended up really requiring a lot of work. We had to find out via her Chinese medicine acupuncturist that she was intolerant to rice, which happened to be in the protein powder that we recommended for her. She ended up on what's called the core food plan, which is a set of dietary principles. We checked for and corrected gut imbalances in terms of probiotics, discouraging undesirable bacteria, using digestive enzymes, making sure she had plenty of short-chain fatty acids. We did a metabolic test called the Nutrival to see if anything was out of whack in terms of having enough B vitamins, enough minerals. We did a hormone test to see if her progesterone, 3 types of estrogen, testosterone, and DHEA were all adequate and balanced or not. We used CoQ10, Butterbur, magnesium into her system through her skin to get good absorption of blood levels, B complex at breakfast and lunch, detox supportive herbs, and herbs that specifically supported the immune system. But ultimately, she did have 90% resolution of her symptoms and was very pleased. And then 2 cases of osteoarthritis. Osteoarthritis is a fancy name for a very simple process, just a joint wears out, wear and tear arthritis. It's not an inflammatory arthritis like rheumatoid arthritis, but the discomfort of osteoarthritis is inflammatory, and that's why a legion of Americans use ibuprofen or naproxen daily to settle down their osteoarthritic joints so they can hike or garden, or in the case of this rancher, string fence or what have you. Anyway, this rancher pinned me in the lobby of my clinic again. I wasn't his doctor. He just saw my name tag and backed me up against the wall. And he said, "I can't use this thumb anymore. I can't string fence. You're a doctor. You fix it." And then he said to me, "I've seen a primary care doc, an internal medicine doc, and an arthritis specialist, and none of them have helped me." So I asked him if he'd tried omega-3 fish oil at inflammatory dosing. He hadn't. I put him on 3 grams of omega-3 fish oil twice a day. A couple weeks later, I bumped into him. His discomfort was down to 2/10, and he was stringing fence again. Also, a woman in the nursing home had a bone-on-bone osteoarthritic right hip, wouldn't walk, and we put her on prescription omega-3 fish oil, and she started walking again. So it can be a really good anti-inflammatory. And then final case, a woman I saw up here, Alaska boat captain, had been through some tough stretches circumstantially and had developed some depressive symptoms. She was tired, she wasn't sleeping well. A couple of years before, a family practice MD had put her on a serotonin boosting drug, and it didn't really help, and she didn't really like it. And when she'd been challenged to restart it, she sought me out to see if we could try something different. Anyway, within 2 weeks on just good nutrient-dense food, getting her exercising, using some 5-hydroxytryptophan, which is an amino acid that's a precursor to serotonin. Again, transdermal magnesium to get easy, quick absorption of magnesium, get magnesium levels up. Some B complex both, well, just at breakfast in this case, and oh, there we go, again at lunch. And then the omega-3 fish oil. She had 90% improvement within about 2 weeks, and I saw her again 6 months later, and she was still doing great. So how does this work? I mean, clearly these are terrific outcomes, and the question then becomes, how does it work? And so I'll just take you on a little tour through the principles here. So what functional medicine says is that the diagnoses are the branches, and we want to look at the roots and the trunk in terms of figuring out elegant ways to intervene. You're going to see some slides now that are a little frustrating due to the small type, and I'd like you to kind of ignore the small print and not be stressed by that. But again, just focus on the big elements. You know, we have these organ-based diagnoses, so people have congestive heart failure, have a cardiology problem, and they have a specialist called a cardiologist. So we really tend in Western medicine, even though we're so proud of how smart we are, it's really odd that we've drifted into throwing darts at diagnoses. I mean, it makes a ton of sense for broken bones. It really doesn't make sense for complex chronic disease. And so just to give everybody an example, somebody goes and sees the cardiologist and they end up on a statin to get their cholesterol down so they don't have another heart attack. Well, that's sensible, but the body getting rid of the statin breaks down a lot of CoQ10, which is an energy-producing enzyme. And as the energy-producing enzyme drops off, that might trigger migraines in a migraineur. So then the migraineur goes to their neurologist regarding their central nervous system problem, and their neurologist starts throwing darts and drugs at their diagnosis. So they start using migraine fighting drugs like triptans and preventers, etc., for the migraines. Well, then those medications have side effects, and the person gets kind of bummed out, so they go see their family practice doctor or a psychiatrist or a psychologist, and this snowball starts rolling. And clearly these interventions at an organ and specialty-based level have a place, but it's clearly part of what's happening with the massive cost and relatively low success rate of our medical system, that throwing darts and drugs at diagnoses isn't enough, given that the majority of the things we're up against are complex chronic problems. And again, if you just take migraine as the primary issue, for example, not the statin drug for the heart problem. I mean, one migraineur is tired and stressed due to the quality of their marriage. That's their trigger. It's a high yield thing to do, to have them look at that. Another migraineur might have some sort of nutritional imbalance that could be revealed on a test or just by taking a good history. Another migraineur might have an inflammatory disease of some sort, or a burden of inflammation that functions as one of their triggers. And so looking beneath the surface of things to help these folks can avoid this sort of pill chucking that a lot of us have gotten sort of disenfranchised with. Anyhow, down then in the roots and the trunk, these are the origins of these troubles by the time they get here. Psychosocial issues, physical exercise or lack thereof, trauma, dietary issues, what are called xenobiotics, things that come in from the outside, and then these are mediated by the person's approach to life, which genes are turned off and on, their physiology, then the imbalances in their actual clinical function, and ultimately then the branches of the tree. So we'll move a little quickly through this. I'll just say as a point of interest, Go To It is part of teaching for functional medicine doctors. And so it's just a summary of gathering information, organizing it, telling it back to the patient, having the patient vet their own history, ordering kind of how to go through intervention, getting something rolling, and then tracking how it works. And I think part of what's really neat is there's a big focus on taking a really good, really extensive history. That conventional training, that 70% of the time what you need to know is in the history, holds up very, very well. Next is the matrix. And this is a way of thinking about the patient that's very, very helpful, and it's used over time. So antecedents, how did this person get here? Do they have predisposing factors? If they grew up in Detroit and drank unfiltered water, could there have been things in the water supply that might have then led them to become tired, and when they got tired they didn't take as good care of themselves, and when they didn't take as good care of themselves they got depressed, and then they got started on their antidepressant? Did they get 20 rounds of antibiotics for recurrent ear infections early in life that might have knocked out their good gut bacteria? Triggers, what tends to kick off problems, and also mediators and perpetuators, what makes things better or worse. It's really important in functional medicine that the spirit and the mind are a central part of doing well or not doing so well, and then these kind of macro ideas, structurally, are they sound or not? Do they have worn out knees? Do they have a bad back? Do they have a brain injury? All kinds of communication issues, chemical signaling via the endocrine hormonal system, neural signaling through the brain, transport issues, how they move things around through their lymphatic and cardiovascular system. This is a biggie. How do they break down and get rid of or recycle things, which is heavily tied to gut function again. Energy, how do they produce energy or not? Defense and repair includes immune function, inflammatory function, and then that sort of signaling from the gut for how those systems work. And this one is a biggie because low-grade immunoinflammatory problems are turning out to be the origin, before people can feel it, of everything from diabetes to coronary artery disease to Alzheimer's. So low-grade immunoinflammatory problems, finding them and getting on top of them before they cause trouble, or calming them down when they are causing trouble. And then gut function itself. Is the gut vital and healthy? Is it not doing so well? How does that affect the person overall? And functional medicine doctors are always thinking about, does the person get enough sleep? Do they relax so that they have restoration as well as the depletion of daily life? Do they exercise and move? Do they eat properly and hydrate? Are they managing stress or getting beaten up by stress? And then what are their support systems? This is the functional medicine prescription, so this is the actual sheet I fill out every day. And again, I'm really proud of the fact that it says MD after my name, but I'm actually pretty much every single one of my patients, I advise them about food. Sometimes they do a great job with their food, so I just put a little smiley face there, keep going. Other times it's like, okay, Twinkies are going by the wayside. Here's the core food plan, or what have you. Put a lot of folks on an exercise prescription or encourage them to keep going. Other is a nice catch-all category. Supplements and meds can go here. Sometimes I end up filling out 3 or 4 of these sheets if there's lots of changes or additions of supplements. Laboratory and imaging studies, and then when to come back. Use of supplements certainly has a place. At the end of this presentation, you'll see that there's a separate talk I gave about supplements as one of these presentations, and Ian was kind enough to tape that. And the first half of the presentation is why you don't need supplements, and the second half of the presentation is why you might want to think about taking supplements. So they have a place for some people, but really the most important things are food, exercise, diet, stress management, resilience, love, loving relationships. I have grown really, really fond of supplements because they're really powerful used properly. This is our supplement shelf, so it's a picture of that area right out there. And we do use professional grade supplements in functional medicine. Manufacturers have to be identified that have manufacturer imposed safety standards that are vetted by the company reputation and third-party testing, because again, these folks aren't FDA approved to get their products to market, so there has to be a mechanism to determine who's safe and who has to be avoided. I just mentioned here on this third bullet, Thorne, Vital Nutrients, Pure Encapsulations, Integrative Therapeutics. There's some of the best companies out there. There are a number of really good ones. But if you're going to advise people about supplements, you have to know who's trustworthy. I just decided to share 2 studies with these initial audiences this presentation was put together for. And I thought to myself, what are the 2 studies I looked at in the last 2 years that just completely blew my mind? And so those are the 2 I'm going to share with you. So the first one is from this guy, Mark Houston. He's a functional medicine cardiologist at Vanderbilt. Imagine, if you will, there's 20 heart doctors at Vanderbilt Medical Center. So it's a big cardiology group. And in that cardiology group, the stuff that the other guys can't handle, these are specialists now, they give to Dr. Houston. So he's the man. Anyhow, he's a functional medicine doctor. And it's not in my presentation, but if any of you are intrigued by this guy and what you hear, he does have a book called What Your Doctor May Not Have Told You About Heart Disease. And it's a real tour de force through other risk factors besides the main ones. Anyhow, he published this study in 2010. And here's what they did. They've already got this big institute, and so they took 3,300 patients plus, and they tested them. Of these 671 patients with high blood pressure, they then did an intervention where they corrected these imbalances that were found in terms of whether or not these people had enough magnesium, enough D-ribose, etc. But basically, they had this very sophisticated nutritional test called the nutritional status micronutrient test, this functional intracellular assessment. And this guy is a wizard at remedying these things, right? But here's the part that really stands out. These folks with high blood pressure could be in the study with any blood pressure elevation, and some of them had pressures as high as a systolic of 210 and a diastolic of 115. And just to put this in perspective, once your top number, your systolic, goes above 180, you can have a stroke-like event at any minute. And similarly, when your bottom number, your diastolic, goes above 105, you can have a stroke-like event at any minute. And furthermore, these people had pressures this high taking beta blockers like atenolol, diuretics like hydrochlorothiazide and Lasix, ACE inhibitors like lisinopril, angiotensin receptor blockers, calcium channel blockers, big gun drugs like clonidine and hydralazine. So not only did they have these stratospherically elevated pressures, but they were taking a ton of drug. So here's the cool part. They do this intervention. 62% of these participants within 6 months stopped all medication. They got their systolics under 130 and they got their diastolics under 85. This is just unheard of. It's a spectacular achievement by any measure, but particularly in this arena. And it just tells us there's a lot of room for improvement in general if we start taking it more seriously, turning around nutrition and other micronutrient issues rather than just throwing pills at things. The other guy that's a real hero of mine, Herb Benson, this guy's from Harvard. He's, again, super interesting. In the 1970s or perhaps even the 1960s, he started studying Tibetan monks at Harvard. So, no kidding, they stuffed him in this back lab and tried to hide this guy. They did not want him around. He was considered a blemish on Harvard and its reputation. He, at one point in his career, where they said that if he didn't have NIH funding within 2 years and publish within a major publication, he would be thrown out for good. His enemies were sort of close on his heels. Well, he did that. He got an NIH grant, and he did publish and survive. Well, now the Benson Henry Institute is a multi-million-dollar, 8-story steel and glass building on the Harvard campus devoted to this guy, and he's one of their proud achievements. So it just is a real testament to perseverance of an idea. But what he did is he said, okay, Hans Selye found the stress response and the troubles that come with stress. I'm going to find the relaxation response. I'm going to find that well of vitality that goes with restorative practices like yoga and meditation and study it. And that's exactly what he did. And here's the most interesting study I know of that he ever published. In this one, what's the date on this? Not that old. I believe it's within the last 10 years. I'm sorry the print is small. But he took 26 folks that had meditated between 4 and 20 years. And then he took 26 novices who had no meditation experience at all. And the elegant thing that he did is he looked at what's called genetic expression, because at the point this study was done, he could actually look at which of their genes were turned on or off. And furthermore, he could study these genetic products and say, are these genes that are turned on kind of helpful and repleting, or are they kind of tearing the person down, sort of stressed out responses? Anyhow, he then takes a third group and he teaches them to meditate. It's only for 12 weeks or something like that, maybe half an hour a day. And he sees how far he can take the novices that learn to meditate toward the degree of genetic expression in the 40 to 20-year experts. And it turns out you don't have to meditate for that long or be that good at it to get similar genetic expression patterns to the people that have been doing it for 4 to 20 years. And furthermore, these are, again, really, really powerful physiologic responses. So these are things that have to do with the power plants of the cells, what are called the telomeres, which are parts of the genes that relate to longevity, undesirable types of inflammation, NF-kappa B, etc. And so it was just a really, really neat study showing that meditation can have a profound effect, but also that you don't have to, you can just jump on the bandwagon and get some of the benefit right away. So I think that's very encouraging. Now the next item is a little bit more in the lay media, but this idea of brain healing is really important too, because so many of us had heard that plasticity of the brain goes away once you hit adulthood. Well, that's really gone by the wayside too. It's been determined that these neural connections and reconnections and what have you can continue throughout adulthood. And the guy that's described this quite nicely regarding exercise is a guy named John Rady. He is a psychiatrist at Harvard. This is his book from 5 years ago or so. And he just summarizes all the evidence from all over the world that 30 to 45 minutes a day of exercise restores those delicate structures in the brain to their prior status. And so the best example from, well, his first chapter is about schools. These kids that do 0 hour, first hour of the day, sort of before first class with 45 minutes of cardiovascular exercise, have about a 30% improvement in academic performance and a 30% drop in behavioral disturbances. He goes on to talk about this woman who, there's an elderly nun cited in the book, and she's part of a group that, part of their devotional practices are that they walk 5 miles a day. Anyhow, she donated her body to science, and when they looked at her brain, they found these neurofibrillary tangles, these sort of spaghetti-like structures in the brain that go with advanced Alzheimer's. And so you'd think if that's what they found in her brain after she died, that she would have had dementia at the time of her death. Well, she was doing great. She was happy as could be. She didn't die of dementia. Nobody knew she had it. Why? Her brain had created all these end runs around all these problem areas. And so that was due to the exercise. And again, it's really remarkable, interesting, important clinical physiology. Matters to patients and should matter to doctors. So question then is, for institutions and communities, where do we go with this information? And again, here's the functional medicine white paper, really a tour de force. If you're in an interested mood, it's invigorating, and if you're a little tired, it's a good sleep aid. I mentioned 0 hour. It's just a reference to a lot of classes and schools say that the first class of the day is first hour. And so 0 hour is this thing John Rady and others have promoted, which is 30 to 45 minutes of aerobic exercise for kids at the beginning of the day. Heart math is a type of biofeedback that reduces fight or flight responses and is very simple and has profound benefits. Eating the rainbow, just a spectrum of different foods, can be very helpful. The head of the Institute for Functional Medicine worked with Pastor Rick Warren to use the principles of functional medicine to help the Saddleback Church. 15,000 members participated and lost 250,000 pounds in a year with the functional medicine approach. Basically just taking advantage of the existing social structure, which was the pastor said, hey, this matters, your body's your temple, and I want you to take good care of it. Lady named Shulpa Saxena, right out of family practice residency, went straight into a functional medicine clinic in Florida, built it up herself. Her admission rate to the hospital out of her clinic relative to other clinics in Florida is about 10% of the admission rate to the hospital compared to other clinics around town. So it's got lots and lots of interest. Mark Hyman was just interviewed by Ariana Huffington over the last few months, and there's a tentative proposal for the Veterans Administration to utilize the Institute for Functional Medicine to get training in turning around diabetes for interested veterans, and that will probably yield data that it's more effective, less costly, less risky, and if the VA starts to benefit, then clearly we may see dominoes start tipping in mainstream medicine more and more. This part at the end, just sort of some points of interest. Functionalmedicine.org is where you can learn more about functional medicine if you're interested. Applying Functional Medicine in Clinical Practice is the introductory course that physicians take, and I mentioned to you already there's now a certification track. There's handouts from the Institute for Functional Medicine. You'll see some textbooks here in a minute, just sort of, again, point of interest. Also, there's a website now, not through functional medicine, but another group called Natural Standard. It allows doctors to look up the data on herbs and minerals and supplements and yoga and Tai Chi, see what the data is on the effectiveness and risks. And it also has an interaction checker So if somebody's taking 7 drugs and 10 supplements, you can plug them all into this natural standard interaction checker and see if they all get along. So there's some pretty cool tools out there.
And that's open to the public, or is that?
No, it's a subscription. Yeah, we pay, SVT pays $2,000 a year for natural standard, and it went up to $3,500 or $4,000 a year right after, the year after we got it. We got grandfathered in at that old low rate. So it's a professional subscription. Anyway, this is the textbook of functional medicine, and surprisingly, it's not something you go to day to day as a doctor, because it doesn't tell you how to tackle rheumatoid arthritis. It just tells you the underlying physiology of how the person gets it, right? So you don't go to it to figure out which herb to use or which intervention. But it's really the Bible of why this all works. And so it's part of that applying functional medicine clinical practice approach, because MDs aren't going to engage this and try this until you convince them that there's data. And every single chapter in here has approximately 300 references from JAMA and Lancet, etc. This is kind of neat, also Institute for Functional Medicine, but this is just the clinical nutrition book. And if lots of folks that like natural integrated medicine, when you tell them, well, hey, magnesium might help prevent your migraines, they say, well, I don't want to supplement with magnesium, I just want to get it my diet. You can go right to the list in this book of magnesium-rich foods, from the most magnesium-rich foods to the least, hand them a list and they can shift their diet toward getting more magnesium that way. This is what's called the core food plan. So this is a handout from the Institute for Functional Medicine, sort of how a person's plate should look in terms of fruits and vegetables, healthy fats and oils, healthy protein, how much people should hydrate. And then it's got a second page, which is sort of serving sizes of nutrient-dense foods, color-coded against the first page. This is a handout we'd give to somebody for eating the rainbow. I know a nurse practitioner up in, it's 2 pages. It just has, sorry again about the small print, but it just has lists of foods that are in each color category, what they do, how they benefit. And I know a nurse practitioner north of Anchorage who got functional medicine training, and she just, when she sees kids for a well kid visit, she just challenges them to eat the rainbow once a day. And then she tells them, when you come back, I'm going to talk to you about whether or not you ate red, orange, yellow, green, blue, and what have you every day. Mm-hmm. And so then they work with their parents to make sure it's in their lunchbox, it's in their breakfast, it's on their dinner plate. And it's really helpful. This is just to let you know there's actually a way you can eat to fight inflammation. It's a 3-page handout. You know, so again, when somebody comes in with rheumatoid arthritis, you can say, hey, there's a way you can eat that combats inflammation. Just having protein with breakfast is anti-inflammatory. Avoiding foods that are pro-inflammatory is helpful. And that's an easy, anybody who's interested, I'm happy to actually grab you all that handout if anybody wants it before you go. Just in wrap up now, this is David Raquel. He's affiliated with the University of Arizona. Andy Weil, who many of you have heard about, has gotten a lot of notoriety, and he and the University of Arizona work closely together. This book actually does take you through just by disease state. And what's kind of cool about this is it says, well, okay, you know, here's a summary of what works in terms of exercise for rheumatoid arthritis, or mind-body, or nutrition, or supplements, or herbs, or drugs. And it's all data-driven. And then they use these A, B, C, 1, 2, 3 ratings to say how much data there is, how safe these things are, and then the arrow is kind of a summary of data quality versus safety. And then they give you the references themselves. So we're really in a whole new era. There's a ton. The classic criticism from mainstream MDs about natural medicine is that there's no data. And the irony is there's so much data that we've got to sort the wheat from the chaff and organize it properly. But we're decades past the point that no data criticism holds up.
What's the name of this book?
Oh, this is by David Raquel, and so this is called Integrative Medicine. It is a professional textbook.
Oh, okay.
So that one I mentioned, Spark, by John Rady, that's for all of us, not just healthcare professionals. The one guy to really pay attention to, excuse me, if you want to read about functional medicine, is the chairman of the Institute for Functional Medicine, Mark Hyman, Hyman. So his second to last book was called The Blood Sugar Solution, about blood sugar and cortisol and insulin. He has 3 or 4 books back. He's got a book called The Ultra Mind Solution, about ways to take care of yourself that clear up your cognition and the crispness of your thinking and your energy. And you'll see at the end, I've got a slide on him. You can just look at a 17-minute TED talk that he gave to get a sense of who he is and whether you find him intriguing. But he's at the forefront. He thinks that Daniel plan that he and Pastor Rick Warren put together can be expanded to 1 billion people in 10 years. And he feels that's possible because of prior head of the World Health Organization realizing some of the most powerful things we can do take advantage of existing social systems. So not as a religious comment, but as a medical, sociologic comment. You know, what Mark Hyman did is he said, well, gee, what'd this World Healthcare Organization guy do? Well, what he did is the head of the World Health Organization found this country in Africa that had one hospital. How'd that work? One hospital, 23 clinics, and 350 churches in the country. And so World Health Organization said, hey, would you hospitals be willing to be local clinics? And they said, sure, we'll do that. And they had a 50% improvement in their healthcare outcomes in 2 years. So again, I'm not making a religious comment at all, but you've got an existing social structure that's willing to help, and you've got the motivation, right? These folks are saying, hey, we want people to be better and we're willing to help fast. So Mark Hyman said, okay, let's try that with the Saddleback Church. Let's put together this Daniel plan where the pastor says, you know, your body's your temple. I want you to take care of it. Here's how. Mark Hyman and others are going to help us. And so Pastor Rick Warren and Mark Hyman, who's a Jew, by the way, you know, they anticipate that churches that are interested can take on this Daniel plan and apply it to themselves and propagate it and perpetuate it. And really any faith-based community that wants to reiterate the Daniel plan can. And Mark Hyman's hoping that what we do is take back our health rather than wait around for the hospitals or big pharma or the insurance industry. He's just saying, let's just go ahead and get healthy. So anyway, if you get a chance to read Mark Hyman, see him on the internet, he's really an inspiring person, at least in my book.
You can get on his email list too.
Yeah.
You get stuff almost every day.
Yeah. So this is a professional text here. Same thing. These guys, this is Bastyr again. This is kind of the Bible of natural medicine. This is an MD who's devoted his career to how nutrition affects health. And then on the SVTHW website, that type of biofeedback that I mentioned to you, the hospital invited me to do a presentation, so I went up there and summarized this biofeedback approach. That's on the SVTHW website as the Power of Heart Math, and also the one I mentioned to you already. If you're interested in whether or not supplements matter, you can access that online. Do want to briefly mention Mark Hyman just once more. So he's got 2 TED-Med talks, and the one that I saw shows him as this kind of draggy, sick family practice doctor in Idaho with big bags under his eyes. He does not look like this. And what happened is he went to China and he was breathing air that had mercury and lead in it from the coal that was being burned in the town in China that he was living in. And he got heavy metal poisoning from breathing this stuff. and he just crashed. He completely crashed. And his TED-Med talk is this 17-minute journey through this nightmare of seeing all of these specialists, right? And he jokingly says that he was diagnosed with a Prozac deficiency and a Viagra deficiency. You know, because all these folks wanted to help him, but they weren't able to put together that what had happened is just he was stressed and delivering babies in Idaho, and he didn't take the greatest care of himself, and one thing crept into another, and he didn't eat right, and then that heavy metal kind of crashed his system. So he ran into a functional medicine doctor who said to him, "You look like crap. I could help you." And they did help him, and he was so inspired he went on to become a functional medicine doctor and ultimately the chairman. But if you get a chance to see that TED-Med, it's really exciting and interesting. And then we'll close with my hero amongst a number of heroes. Gary Ferguson was born on the Aleutian Islands, and he's a naturopathic doctor, and he is the director of wellness and prevention for Alaska Native Tribal Health Consortium. And isn't that remarkable that ANTHC is wise enough to have a Native man who's a natural medicine doctor be their head of wellness and prevention? I think that in itself is a terrifically good sign. And I love this quote from Gary: "We believe that the community, when given the proper tools, can heal itself and take care of itself." So that's the close of the presentation, and I'm happy to answer any questions you have.